Oops, I did it again. Navigating the morning after. We've all been there. You know, that moment when you realize the condom went AWOL, or maybe passion got the better of your best intentions. Suddenly, the phrase, better safe than sorry, echoes in your mind. Don't panic. This is where emergency contraception, or EC, swoops in to save the day. Think of it as your trusty sidekick in the battle against unplanned pregnancies. It's that extra layer of protection, that safety net for those oops moments. But before you rush off to the chemist, let's unpack what EC is all about, shall we? If you find this information helpful, don't forget to like, share, and subscribe for more tips on navigating life's unexpected moments. Emergency contraception. Your safety net, not your safety dance. Let's be crystal clear. Emergency contraception is not your everyday birth control. It's not meant to replace responsible planning and regular contraception methods. EC is precisely what it says on the tin. It's for emergencies. Those times when your regular contraception fails, or you find yourself in a situation where you need to prevent pregnancy after unprotected sex. It's about taking charge of your reproductive health and making informed choices. The ABCs of EC pills and IUDs. Oh my. Now, let's talk options. When it comes to emergency contraception, it's crucial to know your choices and how they work. There are two main types of EC, the emergency contraceptive pill, or ECP, and the copper intrauterine device, or IUD. Each has its own unique benefits and considerations. The ECP, your morning after pill, comes in two forms: levonorgestrel, effective within 72 hours, and ulipristal acetate, effective within 120 hours. These pills work by delaying ovulation, preventing the egg from being released. Remember, time is of the essence here. The sooner you take it, the more effective it will be. Don't wait until the last minute. The copper IUD is the overachiever of the group, boasting the highest effectiveness rate. It works by creating an environment that's toxic to sperm, preventing fertilization. This little superhero can be inserted up to 5 days after unprotected intercourse. Plus, it provides long-term protection for up to 10 years. Choosing the right method for you depends on various factors, such as your health, convenience, and personal preferences. So, chat to your healthcare provider to determine the best fit. They can help you weigh the pros and cons of each option. Finding your friendly neighborhood EC provider. Don't worry, getting your hands on EC isn't like embarking on a treasure hunt. It's readily available at most pharmacies, healthcare providers, and sexual health clinics. In many places, you can even waltz into a pharmacy and buy ECPs over the counter without needing a prescription. And no, they won't be checking your ID like you're trying to buy a bottle of Savannah Dry. Costs can vary, so it's always a good idea to phone your local provider for specifics. Side effects and other considerations. Keep calm and carry on. Now, let's address the elephant in the room, side effects. It's something everyone worries about, but it's important to stay informed and calm. Like any medication, emergency contraceptive pills can have a few side effects. But don't stress, they're usually mild and temporary. Most people experience them for just a short period. We're talking about things like nausea, tender breasts, and maybe a bit of fatigue. These symptoms are common and generally not severe. You might also notice some changes to your menstrual cycle. Your period could come a bit earlier or later than usual, and the flow might be lighter or heavier. But don't worry, nothing a hot water bottle and a good rom-com can't fix. Taking some time to relax and pamper yourself can make a big difference. It's important to note that emergency contraception does not affect your future fertility. This means you can use Dosage without worrying about long-term effects on your ability to have children. So you can breathe easy knowing that using emergency contraception won't hinder your baby-making plans down the line. It's a safe and effective option for those unexpected moments. And as always, if you have any concerns, your doctor is just a phone call away. They can provide you with all the information and reassurance you need to feel confident and secure in your choices. Effectiveness. Timing is everything, darlings. Emergency contraception is highly effective. But let's not get ahead of ourselves. It's crucial to understand that while it can be a lifesaver in certain situations, it's not a substitute for regular contraceptive methods. It's not a magical get out of jail free card. The effectiveness of emergency contraception depends on a few key factors, the most important being time. The sooner you act, the better your chances of preventing an unintended pregnancy. The sooner you take emergency contraception after unprotected sex, the better it works. Ideally, it should be taken within 24 hours, but it can still be effective up to 72 hours after. Some types even work up to 5 days later, though their effectiveness decreases over time. Think of it like this. The clock starts ticking the moment you've had unprotected sex. Every hour counts, so don't delay. The faster you act, the more effective the emergency contraception will be. For those under 70 kilograms, emergency contraceptive pills are about 98% effective. However, weight can influence the effectiveness of the pills. But if you tip the scales over 70 kilograms, a copper IUD or 2 emergency contraceptive pills might be recommended. The copper IUD is a highly effective form of emergency contraception and can be used up to 5 days after unprotected sex. Remember, every case is unique, so consulting a healthcare professional is always the smartest move. They can provide personalized advice based on your specific circumstances and medical history. They can assess your individual situation and advise on the most effective course of action. Whether it's a pill or an IUD, getting professional guidance ensures you make the best choice for your health and well-being. Busting myths. Emergency contraception under the microscope. Let's clear the air and dispel some common myths surrounding emergency contraception, shall we? Firstly, and this is crucial, emergency contraception is not an abortion pill. It does not harm an existing pregnancy. Emergency contraception simply prevents pregnancy by delaying ovulation. It's all about prevention, not termination. Secondly, using emergency contraception will not affect your future fertility. You can breathe a sigh of relief. Accurate information is key to making informed decisions about your body. Stay safe. Stay savvy. Your reproductive health is your power. So, there you have it. The lowdown on emergency contraception. It's your trusty sidekick, your safety net in those moments when your carefully laid plans go astray. Remember, taking charge of your reproductive health is empowering. Stay informed, stay safe, and always prioritize regular contraception to avoid those heart-stopping oops moments. And stay tuned for our next installment, where we'll be diving into the world of natural family planning methods, your body's own built-in rhythm method. Until then, go forth and own your reproductive power. For more information and resources, visit our website and subscribe to our channel. Take control of your reproductive health today.